Men are far less likely to seek help and treatment for mental health conditions than women. That is why men are 4 times more likely to commit suicide than women. And suicide is the 7th leading cause of death for men. Overall, 6 million men are diagnosed with depression annually. That number does not include the millions more who refuse to seek mental health care. Instead, more men are likely to label mental health concerns as physical health concerns. They say they are overworked. They say it's the weather. They blame it on other people. Anything to avoid the perceived stigma of depression and mental health issues. The reasons have to do with old ideas of what it means to be a man. But today, gender roles that men feel obligated to obey are killing them. We know the pandemic has increased mental health issues for men and all Americans. Studies show that alcohol and marijuana use among men increased significantly during COVID-19. These substances are popular forms of self-medication. In general, more than 4 in 10 Americans reported symptoms of anxiety or depression last year. The number is 4 times greater than 2019. Clearly, mental health is a growing concern for all Americans, but it is a potentially fatal problem for men. That is why discussions like this one here today are so very important. They help remove the stigmas around mental health care. They help men understand that mental health is just as important as physical health. And they allow men the freedom to discuss their issues with anxiety and depression with others. This is so critical a step to recovery, whether they talk about it with family, friends, or medical professionals. The only way we can improve men's mental health is to allow men to address it without fear or shame. And given the increased issues with mental health during COVID-19, this is the perfect time to do so. So thank you again for inviting me to speak to you about mental health, and let me know how I can help your efforts in Congress in the future. Thank you so much.